All right, everyone. This is your host, Mark Cuccinella. I'm back again. And on the line is Dr. Timothy Ryan. Good morning, Dr. Ryan.
Good morning, Mark. Thanks for having me again.
Well, thank you for your continued support of our attempt to keep the public informed here in Clear Creek County. I appreciate your efforts. Should we get right to it and talk about what's happening here in the community and throughout the state? What's going on with the virus right now?
Absolutely. So, as you are, I'm sure, are well aware, the pandemic isn't over. The virus hasn't gone away. Basically, what's happening now is the case rates are pretty similar to what they were if you take out everyone who's been vaccinated as a potential for getting the virus. So right now in our county, we've had 4 cases in the last 7 days, 9 in the last 2 weeks. Our test positivity rate's around 7%, 7.5%, due in part to the fact that the only people that are getting tested nowadays are the unvaccinated and those who are positive, which is why we have a fairly high rate. Right now in our county, we have roughly 49.5%, almost 50% of the population is fully vaccinated, with another 5% or so who are awaiting their second dose. So that would bring us up to around 55% of the population, 6 months into the vaccine effort. Similarly, across the state, cases are still, we're at 144 per 100,000. 77% of hospital ICU beds are in use across the state, 37% of ventilators. There's about 450 people in the state currently hospitalized with COVID. And the vast majority, if not all of these folks, are the unvaccinated. So, and similarly across the United States, although 52% of our population, adult population above 12 is vaccinated, there are significant pockets where the vaccination rates are in the low 30s. In some states in the South, basically across the United States, including one of our northern neighbors, Wyoming. So those pockets of unvaccinated will be what is, in essence, the pockets of cases come fall. Once people get back inside, as we've experienced last year, and a decline in May, June, July, and then saw that uptick beginning in August, September in earnest as we move back indoors. So the folks who are unvaccinated are still driving the case counts and will continue to do so into the foreseeable future until we can get the majority vaccinated. So.
Well, I did notice that Colorado, when you look at the state-by-state per capita virus count, Colorado is right up there in the top 5. I'll put it that way. And as you mentioned, Wyoming is in tough shape right now, and Nevada is just jumped up as well. That's probably due to the unvaccinated tourist population going into their state. I'm guessing that's a factor at least. I don't know. I look at the vaccination rates around, let's say, the state of Colorado, and it's not just in the South, but when you look at some of the counties here in Colorado, curiously enough, the counties that have been impacted the greatest with COVID infections, such as Crowley County and others, not off the top of my head that I can name, but others that I've looked at, those are the counties that have the lowest vaccination rate, the people that have been impacted most greatly. I don't know what to make of that.
You're absolutely correct. There are too many counties in this state alone that have vaccination rates in the 30s, low 30s to mid 30s. And 6 months into vaccine efforts, I think that speaks volumes. Unfortunately, I don't really see those numbers going up significantly. They may jump 5%, 10, 15, 20% if we're lucky, but nowhere near where we need to be. And that is, in essence, feeding to the reduction in overall vaccination rate across the state of Colorado. I mean, you look at the entire Northeast, Vermont, Maine, New Hampshire, their vaccination rates are leading the country. And so it really takes the entire state and all the counties. Again, it's these pockets across any state or across the country that are going to fuel the spike in the fall. And as we begin the fall and trying to get kids in school, masks, if the majority of students aren't vaccinated, masks are going to be required, because if you want to have kids stay in school without an outbreak, then that's going to be necessary if the majority of the kids are not yet vaccinated. So, it's really there's a large group of people who want the pandemic to magically be over, but are unwilling to do much to make that happen. And denying reality isn't really a sustainable way to move forward, particularly in a pandemic. The virus doesn't care if you're in denial about reality. It can still significantly impact you and those around you.
So if I hear you right, I think what I'm hearing is that the unvaccinated, that's a pool, a reservoir of virus. That's a place where the virus can continue to spread. Variants can spread within those unvaccinated communities, and maybe one of the variants breaks through our vaccination, and off we go again. I think that's a possibility. I don't know how remote that is, but it's nevertheless until we reach herd immunity, we have that potential to have a crisis once again. Is that what you're saying?
Yes. As we've been saying from day one, the more opportunity you give the virus to mutate, the more likely you are to have a variant, and you're going to have variants, the more likely you are to have a variant that is potentially more transmissible, more deadly, one that breaks through, et cetera, et cetera, et cetera. So, having a handful of people in your community who are unvaccinated is one thing, but having a significant portion of your community, to your point, in many states and many counties, the majority of folks are unvaccinated. That gives life to the virus. That gives the opportunity of the virus to mutate and create those variants that we're concerned about. So the longer that goes on, the longer the virus is able to mutate and create these variants, the higher the probability of these becoming a problem.
Well, speaking of variants, I know that there was talk some months ago. I haven't heard much recently, but some months ago about there being variants that maybe we need to be immunized against, or maybe the vaccines that we've received will lose their effectiveness, and we need a booster shot of some kind. Have you heard any scuttlebutt regarding boosters?
It's certainly in the works. I know that both Moderna and Pfizer, the two vaccines that have been used in the majority of people here, those are both underway, and they're constantly changing them and making sure that they, in fact, cover any variants that come out. So far, I think they've been pretty lucky in the sense of that the vaccines that we currently have and have been utilizing are, in fact, effective against the variants they know of to date. But that's not to say that there aren't variants out there that they just haven't tested for yet, right? So, when the case counts are as high as they are globally, then there are new variants literally every day. So, they're trying to keep up with them as best they can. But again, it gets back to the quicker we can quell this and damp down the number of cases on a daily basis across the globe, the less likely those variants are going to become problematic.
I wanted to zero in on Clear Creek County a little bit. I was looking at the numbers on. I follow the virus primarily on the New York Times website. I think it's mostly information from CDC and Johns Hopkins. But at any rate, I saw that in Clear Creek County, our our vaccination rate is, let's say, average for the state. But when I look at the older population, the over 65 number, it's surprisingly low. 62%, I think, was the number I saw this morning of vaccination rate in Clear Creek County of folks over 65. I know you've been working really hard to get everyone vaccinated who is eligible for the vaccine, but that particular population, it seems surprising to me, given the hard work that's gone into it, that number is so high.
You know, Mark, people have their own reason and rationale for wanting or not wanting something, and we're doing our best to, one, get the word out, but also be as available as humanly possible, both in weekend hours and after hours and locations throughout the community. Anecdotally, we've talked to people about why it is they are uninterested in getting the vaccine, and it ranges everything from rational thought to irrational thought. And so we're trying our best to educate them and overcome the abundance of misinformation that's out there and their misconceptions about reality. So, we've targeted everybody, uniformly in sending postcards and phone calls and all of our town hall meetings, and, the list goes on and on and on. Trying to inform, to educate people as best we can. It's now really up to them to make that decision. Are they interested in protecting themselves and those around them, or are they interested in taking the risk? And as I said now, the virus is infecting the unvaccinated. It's 95 to 99% of the cases. And so it's not a matter of if you're going to be infected, it's a matter of when you're going to be infected, because as we've been talking about, these pockets of people are fueling the continuation of the pandemic and the continuation of the virus and its variants. And so this virus is going to be around for a while. And given that it's going to be around for a while, and given that we've really dropped all of any public health measures to protect people other than vaccines, people are particularly at a much higher risk than they were 5 months ago. And no, it might not seem like it, but you are at much higher risk now than you were 5 months ago. We don't have a mask mandate anymore. People are no longer social distancing. It seems just by mask wearing, everyone's vaccinated if you go out in public, which we know not to be reality. So, we're doing all that we can. We cannot drag people in to get vaccinated. We can only provide the opportunity for them to do that and to educate them as best as we can, as much as they are willing to be informed.
Yeah, that's an interesting way to put it. It's not a question of if; it's a question of when. I'm going to add something to that. When it was up to me to decide whether I wanted a free vaccination or not, which they all are free, but if I want that with the small risk of some side effect from the vaccine, almost negligible risk of a serious side effect, compared to some much larger risk of becoming severely ill, even hospitalized, or maybe dead. And it just... I just don't understand the thought process that says I know that I might get the virus, but I believe that I'm not going to get I'm not going to be severely ill or killed by the virus, and that just seems like whistling past the graveyard to me. I don't know what your thoughts are on that, but that's got to be what people think. It just is not going to happen to me.
Yeah, and Mark, I think you're correct. And part of that is, are they making that decision based on facts, or are they making that decision based on misinformation? And as I stated before, unfortunately, there's way too much misinformation out there that people are incorrectly making that decision. right? And their understanding based on this misinformation is that the vaccine is far more risk than COVID itself. Clearly that isn't true, and clearly it's based on misinformation, but it is part of their thought process. So it's incumbent upon us, and we have been doing this since day one, to post the facts and provide the facts as best we can, and hope that people consume those facts and make sense of them in their decision-making process. We can't keep people from going on the web and finding all the misinformation that there is out there. We can only help counter that by providing reality and facts, and hope that they see ours and process ours before they process all that misinformation. So,
well, let's just remind folks of when and how they can be vaccinated here in Clear Creek County for free. Can you review those options, please? Absolutely.
So we have a clinic all through June on Wednesdays from 10 a.m. to 7 p.m. So that's 9 hours of availability at the Resource Center in Idaho Springs. We have all three vaccines available, Johnson & Johnson, Moderna, and Pfizer. They're absolutely free. Administration of them is free. It's walk-in clinic. Literally all you have to do is show up, and we will get you taken care of, fill out the paperwork, which is just a single page, and get you vaccinated. In addition, we have vaccines available at the Safeway in Idaho Springs, as well as the Safeway in Evergreen and the Walmart in Evergreen. All three of those locations are also walk-in. You do not need an appointment. Those three locations have the Pfizer vaccine. You can literally walk in there and ask to get vaccinated, and they'd be happy to do it as well. So we have 4 locations, some of them daily, within a 15, 20-minute drive in our county. Similarly, I don't know the hours in Summit for the folks on the west end of the county, but Summit County is doing similar vaccine clinics in Summit County. So there's no shortage of availability. We have made them till 7 o'clock because we know a number of folks work and don't have availability until later in the evening. So we had a clinic last Saturday as an example, and so we're going to continue to do those sporadically throughout the next several months and hope to get everyone vaccinated. It's, as you might imagine, very resource intensive to have a clinic, particularly to have one on a Saturday. And so it's, as long as the demand is there, we will continue to have these clinics. But if we're going to set up shop for 2 hours and nobody bothers to show up, then it's kind of a waste of resources from our perspective, and really just focus on our Wednesdays clinic. In addition, we will do home visits, and we have done several dozen home visits to date for folks who can't get to the clinic. We're more than happy to come to your house and vaccinate you there. So we do have a COVID vaccine line as well if you need more information or want to schedule an appointment. And that number is 303-670-7528. That's 303-670-7528. So please leave a message, and we will call you back and get you scheduled and make sure that we can get you taken care of.
Well, you certainly have outlined an array of options for free vaccination that people are for all people who are eligible, which is everyone over the age of 12. So thank you for that, and I'm glad that the county is continuing to provide those in addition to those other resources. I wanted to add that COVID Vax info line, I hated to bother them, but I felt like as a semi-journalist here, it was my obligation to investigate. I called that number to see what sort of response there was. I received a prompt response from a very pleasant person, and it was everything that you would hope that information line would be. So I can personally attest to the usefulness of that resource. So, Dr. Ryan, I changed horses here just a little bit, but I thought I heard last week that the county commissioners were going to stop having a weekly review of the COVID cases and the situation in Clear Creek County. Was I correct that they're not going to do that? And I assume they'll come back if there's some emergency comes up, but there's no plans for continuing those Tuesday meetings. Is that right?
That's well. This week and next week they had some conflicts with it, so it was canceled. Basically, I don't know if they're intending to reinstate it. My guess is probably not on a weekly basis. I will continue to send them the numbers that I have been for many, many, many months, and continue to do that on Tuesdays. So I don't know what the status is moving forward, if we will continue to have a formal update, or it will just be a informal, here's the numbers sort of thing. But we'll see. Not my call.
Well, in any case, you're certainly welcome on the radio anytime, except, of course, I'll be out of town for at least 4 weeks, maybe 5. But when I return, I'll get in touch with you, and we'll make arrangements at your convenience.
Sounds good, Mark.
Before I let you go, a couple of other things. I want to talk about the clinic some, but first, just one other thing about infectious disease. What are some of the other concerns that you might have for infectious disease as it is occurring right now in our community? Or what are some of, as you look over the horizon, what are some of the dangers? Because I look at what's happened over the last 20 years or so, and I see all of these worldwide virus and even bacterial infections that have spread and could have been as bad or worse than COVID, but because of our very sophisticated health system, we were able to stamp out those epidemics before they became pandemics. But I'm sure there are other things that are looming on the horizon. Do you have any sense of what might be out there?
Well, there's lots out there, and as we saw recently with a mumps outbreak in the last several years, it's really important to get all of the vaccines that are prescribed by your physician in a timely manner, whether you're an infant or a grown adult. And, for example, getting a varicella booster for those of us who were unfortunate enough to have chickenpox. As adults now, even though we had chickenpox, you could potentially still get shingles, which is the adult version of chickenpox, far more painful than chickenpox, but something that is completely preventable with a vaccine, and a vaccine that's been used for many, many, many years. So there is so much out there, and that one of the things that we try to do is really, and it speaks to the need for a robust public health team. We've had this discussion before about public health in the United States, most generally, and the neglect it's had over the last 40 to 50 years, both in funding and every other way. So hopefully this pandemic has brought light to the subject, and that we will now have a more robust public health system that can monitor for these things, right? We're sort of the gatekeepers, if you will. People either show up at their physician's office with something, at which point it's reportable. The infectious diseases are reportable to us, so we'll know right away, and we have a system in place that helps us address those as quickly as possible to stem the outbreak. And I think that's the system you were alluding to, that we have a system in place. It's just a matter of having the resources and the ability to react to those outbreaks. So potentially one case could turn into 10, 20, 30 cases quickly, but when we're alerted of them initially, we have the resources to address them. So all of the vaccines that you receive as a child and as an adult are meant to protect you and prevent the outbreaks that we have seen when folks don't get vaccinated for those most basic ones.
Yeah, I'm glad you brought up shingles, because as a retired paramedic, I'm here to tell you that of all the people in pain that I've ever seen, and on a scale of 0 to 10, I would rank shingles up there with some of the most painful conditions that I have seen in my career. Grown men and women crying like babies because of the pain from the shingles, when all you need to do is go to the pharmacy or your physician and become vaccinated. It's covered by your insurance, and it's just so easy to do. I don't know why you wouldn't do that. And on the broader perspective of public health, is there any place that we can invest money where we'll get a greater bang for our buck? I can't think of one, because if you wait till till it's too late, if you smoke until you have cancer or emphysema, if you name your poison, if you do those things without regard to your wellness and your health, then if you think the doctors are going to put you back together, you are sadly mistaken. It's over. And so prevention is the key there, and that's where public health comes in.
Absolutely, and as we all know, prevention is a heck of a lot cheaper, a lot less painful, and it prevents the things from happening that you don't want to happen. So, but as you know, and an important subject is, over the last 14 months across the country, many people have foregone their annual checkups, their annual visits with their physician. So I would strongly encourage folks to set up those appointments that you've avoided for the last 14 months, and update your immunization record and update anything that you need to be examined. Now is the time to do it. Doctors are thirsty, for lack of a better term. Given the last 14 months, their businesses have dropped off like everyone else's. So they're more than happy to take you in and give you that exam and make sure your vaccination records are up to date.
Yeah, I had my annual last month after foregoing my visit in 2020, and my doctor took extra time and was extra attentive to make sure that he wasn't missing anything because of that long delay between his opportunity to check me out. So I think that's probably the kind of experience that you can all look forward to, is someone taking a good hard look at your current health and taking appropriate steps. Dr. Ryan, I wanted to spend the last few minutes with an update on the clinic here in Idaho Springs. We're all so excited that this has finally come to fruition after decades of dreaming of such a facility. Give us another update, if you would, please.
So if you've driven or walked by there in the last week or so, you've noticed significant progress. The roof has finally been installed, meaning the metal roofing. The parking lot has been paved. So everything is sort of moving into place. I know Centura, the last time I heard, they were intending to be fully operational the beginning of September. And so we hopefully in Public Health and Human Services will be taking occupancy sometime in mid to late July. We don't know yet conclusively. Partly there is a bridge that goes across the creek from the parking lot to the building. That's sort of the delayed factor, and just waiting for that to be installed. They sort of want to have everything in place and shiny, if you will, before they open the doors. So sometime late summer, mid to late summer, we should be in there and operational. Downstairs, as you know, is going to be the Centura Clinic, the urgent care clinic, as well as, and I haven't seen any contract, but I believe a physical therapist office will be in there on the first floor as well. And then upstairs will be Public Health and Human Services. as well as JCMH, so Jefferson County Mental Health Services, will be upstairs, and a number of counselors available. So sort of a one-stop shop, whether you have physical needs, physical therapy needs, mental health needs, or just needs in general, and or vaccines from public health. We will all be in that one location. So very excited about it. It's a great building. I think will be a great service and great opportunity for the community, so they don't have to go down the hill for most of the things that they may need, whether it be just a general doctor's visit or a vaccine or a follow-up in physical therapy. It'll be right there.
Well, I'm certainly looking forward to the day that it opens and those services are available. So convenient, as every thriving community should have such a facility, and now we're going to have one. So that's just the greatest news. Now, when you move out of the resource center, what will happen with that building? And by the way, folks, I know that even after all this time, people don't know the resource center by that name. It's the old post office. So what's going to happen to that building?
A couple things. First, I want to give a shout out to my predecessor, Cindy Dickin. She was the driving force in what is going to be the Collaborative Care Center. She is the reason, in my mind, is why it's there. One of the many reasons. So hats off to her and her dedication and motivation to get that done. As far as the post office is concerned, I have no idea. It's not in my wheelhouse in terms of what happens to that building. Sort of once we move out, sort of out of sight, out of mind. I think that's a challenge for the county to figure out and what they want to do with it and moving forward. So I've heard a couple ideas thrown around, but I don't know which one of them are actually going to be reality, and hesitate to mention any until the powers that be decide that.
Well, the bottom line is that you'll be moving into that bright, shiny, brand-new facility, and there will be additional services available. You've got extra nurses that you've been able to hire. I just think that we're headed in such a positive direction. I want to give a shout-out to the leadership that's been provided by the county commissioners. This current bunch of commissioners has recognized the need and has done what they could to make this facility a reality. So kudos to them as well.
Yeah, I agree with that.
All right, Dr. Ryan, I guess that's it for until the end of July or maybe early August. I hope you have a wonderful month, and I know you're sending your daughter off on a big journey. I hope that goes well for her also, and have a great time. We'll talk to you on the other side.
Sounds good, Mark. Have safe travels and be well.
Okay, bye.